Video, I'm discussing about a recall communications, that is a baby with hypothyroidism, that is abnormal guthrie and the thyroid function test, explain the diagnosis to the mom and discuss the treatment and the investigations. So we find a baby that is congenital hypothyroidism. So it is an educational scenario. Also bad news, of course, mom, and discuss the treatment investigations. So as usual, we are starting like IRCAP, introducing myself, make a repo, taking the consent, I am telling the agenda, attendance plus prior knowledge. Then we have done the screen test routinely what we did for the old baby and found that it positive for hypothyroidism. Then giving the explanation. So what is your, have you any idea about hypothyroidism? We'll ask that, and after that we'll give the explanations. So in front of our neck, below the Adam's apple, if needed, we will draw a pictures of a thyroid gland. In front of our neck, below the Adam's apple, there is a gland called thyroid. It is a butterfly in shape and producing substance control many of the our body systems. Then what it causes, it may be decrease the hormone synthesis. Sometimes what happen, this gland can be missing or can be active abnormal. It can be small gland and defect in the gland in the brain. The defect result in physical, mental, sleep and sexual. So the functions and first the location description we are telling. Then the mother may be asked about that. Are you sure about the diagnosis? Until now, this is a screening test done routinely for all the babies and we will confirm by test and do jelly scan on the gland after discussion with the gland doctor. So for the confirmation, we have done the screening test and we find this positive finding and will be confirmed by other test and we will do the jelly scan of the gland after discussion with our gland doctor. Now, if you will grow normally, the mother is asking. The good thing is that if he take the medications early, normal development of the mental function can occur. But delay may cause the mental retardation and symptoms of hypothyroidism. So if it is luckily we can reach the diagnosis, we know that this condition, so we start the treatment. If he start the treatment immediately, then he can be lead a normal life without symptoms free for hypothyroidism. If it is delay, it causes mental retardations and the symptoms of hypothyroidism. We'll mention both. But what happen if confirmed test appear normal? So gland doctor withdraw the treatment. If after when we do the confirmation test, if it is negative come, then gland doctor will withdraw the treatment. When we can start the medications? We have done screening test. Next step is to take the sample for confirmations and start the medications. Must started before 18 days. Arrange a meeting with the gland doctor and review result of the confirmations. So the treatment, this is very important information, must start the treatment before the 18 days old of the newborn baby and we will confirm the screening test, we will arrange meeting with the gland doctor, everything we will do and before 18 days we will start the treatment. So what is the medications? We will replace the deficient hormone by a medicine called L-thyroxine tablet and liquid but not preferred because of the bioavailability. So L-thyroxine tablet is the treatment our, which is the replace the deficient hormone by the medicine. How come this tablet can taken in this age? So it is a nice question. I understand your concern. Like that positive word we will tell, and it is dissolved in water and formulate, but given by the spoon, crushed and taken on empty stomach at sometimes every day, at same time every day. So the tablet will be crushed. We can dissolve in milk or water and take in empty stomach every day at the same time. If he cannot given by bottle, Momo is asking, then best is given by the dropper or syringe to be sure that he take the correct dose. If he vomit the medicine, so if he vomit the medicine immediately, like repeat it again. If he vomit immediately, like half an hour, then we repeat the medicine. What I do if there is forget dose, give as soon as possible. It has cumulative effect. You will follow till 3 weeks, so will not depend on level. We will monitor the symptoms. So we will monitor, and when she remembered that he missed the dose, he will give that. He will follow till 3 weeks, so will not depend on the level. Okay, this medicine has drawbacks. Yes, some drawbacks. That is heart racing, sweating, loose motions. Summarize. So heart racing, sweating, loose motions are the side effects. And summarize leaflet as usual. Support good. Everything will be mentions. The test, the monitoring will be follow up. T3, T4, TSH. Monitor the thyroid function test specially. Search for other any congenital anomalies present or not. If symptoms like heart racing, loose motions, need adjust the dose. So she will be adjust the dose. She will be under follow up monitor and will adjust the dose if there is any drawbacks already we know, heart racing, sweating and loose motions. And medical colleague if this scenario, Then we'll add the TSH level. If it is less than 10 microunit per liter, then the test is negative. If more than 20 mu per liter, then it is suspected. So less than 10 is negative, more than 20 suspected. So this is all about the recall of congenital hypothyroidism. Thank you.